Everybody's ready?
Okay.
Okay. So I'm going to call the meeting to order of the Delaware County Board of Health. I have a few chair announcements. There was an executive session held on October 24th and October 29th of this year. And well, I think the rest of my thing will come under the other new business. So I'll hold on that. At this point, we open public comment on any agenda items. Oh, I think everybody can, you want her over here? Oh, at the podium, because we have the online. Thank you. And again, if you could just say your name and.
My name is Karis Coker in Concord Township. And while I think of it, I hope each of you have a wonderful Thanksgiving coming up next week.
Thank you.
I'm speaking to agenda item concerning the appointment of the new health director. So I had asked once before on this matter, and I am just here to point out that the state law requires the both elected officers and appointed officers to take the oath of allegiance and loyalty to the United States Constitution and to the laws of the Commonwealth. And I will be looking for that to be on file and recorded with the Prothonotari's office in the future. And along that line, that would include our Bill of Rights, which is a part of the Constitution. And I hope that this board and this office of government, the Board of Health in Delaware County, and the administration of your duties for the good of the citizens, that you will be very conscientious and careful not to trample on those rights. Thank you.
Thank you.
I must leave early. There was another meeting that I'm going to be late for, but I
Okay.
wanted to come here for this time. So thank you very much.
Thank you. Right. Any other public comment? Seeing none, we're going to be moving to the approval of the minutes from the previous meeting. Is there any changes to the minutes? Seeing none, do I have a motion to approve the minutes?
So moved.
Lily, okay, second. All in favor? Aye.
Aye.
Great, thank you. And then we have our director updates.
Thank you. Just had a couple of things I wanted to mention. One you may have seen in the news that we did have the first confirmed Clade 1B Mpox case in the United States. It was reported in California on 11/16. It is travel related to the outbreak in Central and Eastern Africa. There is, no change to any of the recommendations for the general public or providers. It's just, this was expected that we're seeing travel related cases in other parts of the world as well. There's no impact here in Pennsylvania at this time or Delaware County, but it's just updating that this has happened. And we're actually using this as a positive that the enhanced surveillance that was put in place to monitor for this detected it, and all the public health processes are working as they should. That was one item. Another one I wanted to share, you've heard before about our mosquito-borne surveillance program. And now that the program has closed for the 2024 season, this was not in the consolidated report because I didn't have those numbers at this time, but I wanted to share it now. And Susan, I'll send these as an email to you. But so during the 2024 season, 27,003 adult mosquitoes were collected, 11,353 mosquito larvae, and 1,004 tick larvae, and 132 adult ticks. So it's a lot of collection. Again, surveillance working the way it should. We did 495 control events. 3 of these were the adult-side truck-mounted sprays. The rest were all larval control. So some numbers from that program.
Can I ask a question?
Absolutely.
How many positive pools do we have?
Oh, I should have gotten that number for you. I'll have to look that up. Oh,
Was the spraying related to the positive pools?
yes.
Okay.
Yeah.
That's what usually triggers it. Not just.
What else? The only other thing I was going to share was an update on our Test and Go public health kiosks. And Sean, we have a couple of slides for those in the slide deck. So, we had 3 of those installed, one at Keystone First in Chester, one you might have seen as you walked in the building here in Media at the Government Center, and the third one at our Wellness Center in Yaden. Oops. And we've been collecting data on the use patterns so far. Sean. You can go ahead and get right here. So we've done 912 product dispensions so far.
Wow.
It's been pretty popular. We were surprised. Government Center is getting the most. So we've had 534 here. The Wellness Center in Chester then it follows, and Yaden has the least traffic at 114. What's most popular are the home COVID tests. Obviously, some people like that that's freely available 24 hours. So followed by the first aid kits were very, very popular, and some emergency blankets. There is some differences in what's dispensed by location. We were happy to see that we were serving folks that don't have health insurance. 20% of the folks that were getting the products indicated that they did not have insurance, though a good 13% didn't, you're allowed to get a product even if you don't say, and they didn't identify. You can see the chart there's got it's color coded. It's the blue ones are Media, the orange ones are in Chester, and the gray ones are Yaden by product. We've been doing it since September 18th. So we were analyzing the zip codes of folks served. Not unexpectedly, the most served are the ones immediately near that kiosk, but Media, and this makes sense given it's such a high traffic area for services and the jury duty and so forth, serves a lot of other zip codes. The most variety comes here to Media. So one of the visions for these kiosks was that it has a specialty aspect that you can get lab tests. You can do a respiratory panel, which is COVID, flu, and RSV just being added this month, or we just added this month also an STI lab panel. Not seeing a lot of usage yet for that. So hoping that grows. I don't think people are that familiar with that being there. We've got an advertising going on right now. It's on buses. We've been doing other promotion. People will get, I think, more and more familiar with the fact that this is an option. You can see the types of products. And I think Victor pointed out one of the nice things we did see that the few tests that were dispensed were and in some of the zip codes where we were hoping would get that. So that was a good sign. There might be one more slide, I think. Oh, just some more on the user demographics. You can kind of see by race and ethnicity on this slide.
Just real quick, did they, so for the information that was it sent out to local providers that this is available?
We did send it out to the Medical Society and they distributed it to their members. Anytime I go anywhere, I'm trumpeting that they're here. We don't have the best line to all the providers, honestly. It's hard.
So, because I'm just thinking that if you put it out through the hospital network, through Mainline Health and through Fitzgerald Mercy and Crozier, that they might be able to
You can keep trying to, that's a good recommendation.
contact them.
Yeah.
Because that was some of the things that we did in COVID. So just to get that information out there.
Yeah, I know where I did the walk with the doc with the Medical Society in Mill Park last month, and a pediatrician, I forget which practice he was with, but he's going to be the new president, and he was saying how he was really excited about the STI test because he sees younger people that need it and that they would find this helpful. And so trying to get the word out.
Yeah, no, it's great, but it's a great program.
This is great. Are you talking to schools or like Delaware County colleges too? Because I think they'd be interested as well.
Another good recommendation. I don't think we've started promoting it to the IHE, so we should do that. Yeah.
And is there anticipation of trying to have other sites for this? Or
Well,
just
we would like to actually have more, but we proposed under the county's opioid settlement to try to get 2 more machines. But I think we'll learn later by the end of December whether we're successful with that. We definitely would need more funding to get more machines.
A question about the STI test. So basically, they have to send it to the lab. And I assume they would get the results back. And how would we assist them in getting treatment?
Well, that's a great question. So they do have to, they can return the test at the machine, or they can put it in the mail with the pouch. The results are then reported to the health department and the state like normal. So we get the result and then we can follow up. But Steph, we also included a card with each of the STI tests that gives them information about how to follow up and find us. And we did that extra step too, right? Mhm. We did an email, right? They actually also get an email reminder about how, yeah. Because obviously that's what the point, to get the test and then you follow up with treatment if needed, so. Yeah. All right, thank you. I think that was all the main items for my update.
Any other questions, Oni or Emery?
Or nothing from me.
No, nothing here.
Right, so at this time, I'm gonna move to new business. And the top of it is the appointment of our new health department director. And so I want to officially read the letter from the Pennsylvania Department of Health. The Pennsylvania Department of Health received your request to certify Laura Warner, MPH, as a candidate to fill the health director position for the Delaware County Health Department. The department supports the selection of Laura Warner, and she is certified to serve as the health department director. Thank you for your continued support of public health in Delaware County, and we look forward to continuing to work with Laura and the Delaware County team. And it's signed by Deborah Bogan, who is the Secretary of Health. So,
Congratulations.
Congratulations and thank you.
So one of the last things that we have to do as a board, so Laura it's a three-step process for the health department director. One is that there was an interview process. So we had several candidates, really good candidates for the health department director. And so that was a long process through September and October that we went through. But, then we submitted it to county council and to the Department of Health for their approval, and county council approved yesterday. And we have the letter from the Pennsylvania Department of Health. So the last part is that we as a board have to officially accept Laura as the health department director. So it's my pleasure to say that we have Laura Warner as willingly and not knowingly has accepted the position. And so I'm just going to ask the board to finalize her appointment. So if anybody wants to make a motion.
Should approve.
Second.
Second.
Aye.
Hi.
Hi.
So Laurie, this is the official presentation. Thank you. And thank you so much for all that you're doing, and we're excited to be working with you.
Really excited as well. And this is really a thrilling time for us at the health department. So much change, so much growth, and thank you for supporting us in this and for supporting me. Thank you.
It's our pleasure. Anybody want to say anything else? Okay. So the next item on our agenda is a code resolution item. And at this time, Laura, I was going to ask you if you could speak to that.
Right, and this is very minor. We're actually missing the word late in front of the word fee in the code schedule, but it was causing a little bit of confusion for people when they were renewing, because they were just wanting to pay the lower fee as opposed, and it's not the annual, it's only if that's the late fee. So that's the entire resolution, is adding the word late in front of the $47 fee for license and renewal.
So Laura has suggested that we make that code change. Can I have a motion to accept?
Second.
Second. All in favor?
Aye.
Aye.
Hi.
And Emery, you good?
Sorry, I said aye, but maybe you didn't hear me.
Thank you. Okay, so the motion has been approved to make that change, and that'll appear in the updated codes soon. Okay, great. And then at this time, we're going to have an EPI update from Dr. Victor Ellis Rowan.
Yes, it's
Is
you.
it you?
Oh, that's why you gave it to me. You thought I was gonna do it. No, it's you. No.
If you,
that
you have to use the
microphone.
microphone.
Good evening, pleasure to be here. Director, Stephanie, Robert, and our dear guest. This is a very brief update about sudden infant death syndrome. Oh, it's right over there. Okay, so the next slide will tell you only 2 slides. One is about what sudden infant death syndrome is all about. Really, the cause of this type of death in an infant is not very well known. However, there are 3 significant factors that point to maybe explaining why this is happening. And let me go through them very quickly, and then we will go into the numbers. So they call it the triple risk, and this is from the National Institute of Health, this summary. Baby might be born with unknown medical conditions affecting the heart rate or breathing capability. So that's one. The other one is that during the first 6 months, there is a rapid growth type of process, and that can promote changes in blood pressure, breathing, and sleeping patterns. So during those periods of fast growth, the body of the baby might be unstable and react to unusual or in very unexpected ways. That's the second one. Now, the third one is the one about outside stressors. For example, secondhand smoke is one of them. The other one people have seen, if you put the baby to sleep facing down on the stomach, that has been associated with a number of sudden infant death. So what is now recommended is back to back. Put the baby to sleep on the back. When I was a young father in the 70s, we put our daughters, the pediatricians told us, the wrong way. So now we know better. So those are the 3 main risk factors that we know about. The second slide is about the numbers. Just to give you an idea about how big this problem is. The data that you're looking here is from CDC Wonder, which is a recollection of state and local data. They put it together up to a point. And what I wanted to show you is that United States, in the first chart, Pennsylvania and Delaware County. Look at the numbers, but look at this. This is number of sudden infant deaths from 2007 to 2022, over a decade. So how many in the United States? About 27,000. How many in Pennsylvania? 965. How many in Delaware County? 28. But the interesting thing is that we look at the other column called death rate per 100,000. We're using rates. We calculate the number of deaths, divide that by the number of births in those 15 years, and multiply that by 1,000, and that will give us the rate. But look at those rates. 0.43 for US and Pennsylvania, 0.26 for Delco. So we have a lower SIDS death rate during those 15 years compared to Pennsylvania and the United States. Now, we do not have a lot of data at the county level, small numbers, privacy issues. So what I did, I put together some Pennsylvania statistics to show you some patterns, some interesting patterns. Remember that we said that we have 965 deaths, total deaths in Pennsylvania? Well, look down at the next table. It says PA marital status. Look, out of those 965 deaths, 700 occurred in unmarried couples. So it's a big difference, man. Look at the rate on your right side. 0.76 unmarried, and look at married, 0.20, a lot lower. So it tells you something about this association. Again, these are associations. This is not that one thing causes the other. Now, when we look at race, then we're going to look at Black or African American with higher rates. We're looking at the rates on the right, 0.63 compared to white. And the other one, more than one race, that's difficult to judge because we don't really know how many races are included there. Now, let's move to the next area, gestational age. This is very interesting. Look at this. Less than 32 weeks of gestation, you have a higher rate. And again, the rate is in this column. And it's more telling than the numbers. 28 to 31 weeks of gestation, 1.17 sudden infant death for every 1,000 births. When you look at the number of, the number of weeks of gestation increases from 32 to 35, the risk of death from sudden death decreases. From 1.17 goes out to 0.99, and look at how it progresses in a nice way, in a positive way, with higher number of gestational weeks. However, look what happens when it goes to 42 and over, begins to increase again. So it tells us that fewer gestational weeks of gestation is a bad thing, as well as too many at the end. So that's what the story that the data is telling us, at least it's what's telling me, which I find is fascinating. Now, look at birth weight, the same pattern. Low birth weight, which is basically less than 2,500 grams. Very low birth weight is less than 1,500 grams. So when you have between very low birth weight, and which is 1,500 to 1,999 grams, you have 1.42 sudden infant death for every 1,000 births. But if you go to higher weights, it decreases. The rate decreases to 0.26. So this, you see the pattern of birth weight association with sudden infant death. And that's about the data that we have on SIDS. We don't have anything else more than that. We're trying to collect more precise data for the county, but it requires a number of steps and takes more time to do. So pretty much, I believe that what you see in Pennsylvania most likely will be happening to some degree in Delaware County. And that's about it. Any questions?
That's great. Thank you, Victor. Anybody questions?
Thank you.
Dr. Richter, I was hearing that there was an increase in SIDS in like especially the Chester City area, Delaware County. Did you see that recently as well?
So if you notice, the numbers there are through 2022. So
Yeah.
there's a lag, and we have heard anecdotally about concerns about that in Chester. It certainly spiked a lot of the efforts that we're collaborating on with partners. But as far as confirming it with numbers, we can't do that at this time.
Yeah, anecdotally, there were reports, but again, we would need to calculate, get the rates and so forth. But definitely what they reported makes sense, in the sense that the number is higher in short amount of time. Compare this, 15 years, 28. 3 in less than 1 year needs attention. Congratulations.
Thank you, Victor.
My pleasure.
Thank you, Victor.
And at this time, we're going to have the personal health presentation by Stephanie Reese and Robert Spear.
You'll notice a theme on maternal child health this time.
Yes,
So
yes, and we appreciate that.
Alrighty, I won't be up here long. Good evening, everyone. I am Stephanie Reese, the Administrator for Personal Health, and we will be presenting to you some work that we're doing within our Personal Health Division around maternal child health and addressing the infant and maternal mortality rates in Delaware County. We've been functioning or working with 2 different grants, our Title V Block Grant and the Department of Labor grant, MCH DOL grant. Robert Spear, who was at the time, when we first hired, was a community health planner, then promoted to supervisor, which was born out of these grants. So, and we just hired Samantha Collins as his community health worker to support the works around maternal child health. So I am going to turn it over to Robert so he can talk about all the things that we've accomplished with these grant monies.
Thank you, Stephanie. Good evening, everyone. Again, my name is Robert Spear. I'm the Maternal Child Health Project Supervisor at the Delaware County Health Department. And I am here to just go through a few of our maternal child health programs that we have working right now and to answer any questions that you may have. To start off, I'm going to look at the Title V program for the past fiscal year, which was 23 to 24. DCHD had partnered with 4 community partners to advance doula services offered in Delaware County and improve access to assistive technologies for children with special healthcare needs. Our partners included Maternity Care Coalition, the Foundation for Delaware County, Petaway Pursuit Foundation, and the Delaware County Intermediate Unit. Services provided using Title V dollars included free training to aspiring doulas, free prenatal and postpartum visits by doulas to Delaware County residents, free birth attendance by doulas to Delaware County residents, and funding for the DCIU to expand its assistive technology library. Some of the outcomes that we saw last year was Petaway Pursuit Foundation providing 23 prenatal visits, 18 postpartum visits, and 8 birth attendances to a total of 10 clients, 8 of whom were Black or African American. Maternity Care Coalition did provide training to 16 new doulas to serve Delaware County residents, including 2 doulas that can speak Spanish and 10 doulas who are Black or African American. Foundation for Delaware County trained 4 new doulas and provided 40 prenatal visits, 18 postpartum visits, and 11 birth attendants to a total of 23 clients, 19 of whom were Black or African American. And the Delaware County Intermediate Unit purchased assistive technology devices totaling $84,000 to expand their assistive technology library. And they will, and I just want to say they will be purchasing additional assistive technology in the needs assessment that we'll be doing this year. So for our Title V program in this fiscal year, we have some new partners, including Cocoa Life Foundation. And services to be provided this year will be Petaway Pursuit Foundation training 4 doulas to provide up to 4 prenatal visits, 2 postpartum visits, and birth attendance to 8 Delaware County residents. That agreement was signed on September 5th. Cocoa Life Foundation, our newest partner, it will be providing 2 to 3 doula resident engagement events. And that will be also offering to expand their remote doula support services to provide free prenatal, postpartum doula and mental health support groups, and Dial a Doula text service, providing postpartum transition consultations and supporting the MoMA campaign. And that agreement was signed on September 7th. Or I'm sorry, yes. I think that should be actually October 7th, sorry. Foundation for Delaware County will be training 4 doulas to provide up to 2 prenatal visits, 2 postpartum visits, and birth attendance to 12 Delaware County residents. And then the Delaware County Intermediate Unit will be running a needs assessment across 3 of their administered programs to evaluate each student's specific assistive technology best fit and to match students with those best fits. The DCIU will be using around 1/3 of their budget for contractual services to complete the needs assessment and 2/3 for equipment purchases that are identified as being needed by the assessment. And that was recently signed as of yesterday. So now to go into our Department of Labor grants. Development of the application for funding through the DOL grant began in summer/fall of 2023, with the initial drafts of the project narrative, abstracts, and RFPs for partner selection being formulated in consultation with community partners. Our grant application and RFP development continued through the beginning of 2024 and up until final grant submission to the Department of Labor and RFP release to invited partners. Grant was awarded to the DCHD by the DOL on May 30th, 2024. And our selection notification to the partner to advance this grant was made on May 31st, 2024. So just some additional information on this grant. We have three components of this Department of Labor grant. The total grant is $954,000. But the first part of that was the growing and diversifying the doula workforce program. And that is going to be completed by the Foundation for Delaware County. With a total of $600,000, their goals for that program are to reimburse doulas for services through Medicaid billing, mentoring new doulas, and developing a doula registry. For our second leg of that grant, we partnered with Temple University with an award of $200,000. And that will be used for the goal of developing a birth companion training course for nursing students that incorporates birth simulated and real life experiential learning. And then for our third partner, which is us in collaboration with Foundation for Delaware County and other partners, we want to develop the pilot for a centralized intake system for maternal and child health services in Delaware County. And that aspect is going to be, as I said, a partnership between us and other partners like Foundation, Maternity Care Coalition, Pedaway Pursuit Foundation, and various other partners providing maternal child health care in this county. The goal is to have a centralized system or a one-stop place for maternal and child health care in this county. So people ideally have a phone number and a website that they will be able to call or go to be directed to all these sources instead of having to navigate it on their own. And again, that will be the pilot program. So we're hoping to have that pilot launched by the end of our Department of Labor grant, which would be December 2027. So progress so far for the growing and diversifying the dual workforce program. Initial development of the Delco Community Doula Collaborative website, which will contain the registry of doulas operating in Delaware County and offering services. And that registry will contain information about their specialties, cultural congruency, language proficiencies, and other specializations that they may have. In addition to this, we have the creation of project-required job descriptions with anticipation to fill those job descriptions by end of 2024, as well as the beginning of outreach to local doula organizations and doulas. For the developing of a birth companion program, progress so far includes extending an offer to hire a doula trainer. Temple has begun curriculum development with simulation scenario drafts for week 1 and 3, and didactic lectures completed. 2 clinical sites have been secured for students to observe labor and postpartum experiences, and a draft of the IRB application is complete. And for developing the centralized intake program, our progress so far has been convening the centralized intake working group, developing business requirements for centralized intake, and scheduling partner tours of the DCHD call center that will be directly involved in centralized intake system. So moving on to our HRSA grants, we have a partnership with Once Upon a Preemie. And this is a program. It's going to be expanding Black maternal health and neonatal health equity trainings to Delco healthcare professionals. Our funding amount is $150,000, approved by County Council on May 15th, 2024. Grant activities include providing free and virtual health equity training courses to up to 100 healthcare professionals serving Delaware County birthing people. And these trainings will include an introduction to health and racial equity in the NICU, solutions for addressing inequities pre, during, and post-NICU, and then addressing Black mothers' mental and emotional health pre, during, and post-NICU, as well as Black parents as partners in delivering care. Once Upon a Preemie books will also be shipped to all healthcare providers who successfully complete the course. So progress so far in this grant has included begun outreach to healthcare professionals serving Delaware County residents and the recruitment for course enrollment in January 2025. So far, we have 60 people who have made their intentions to participate in the trainings. And then finally, we have our community health improvement plan. So the Maternal, Parental, and Infant Community Health Improvement Plan Committee has been meeting since March 2023 and has developed various goals, strategies, and objectives to achieve for Delaware County by December 2028. As of October 23rd, 2024, there have been 7 meetings total, with the next meeting scheduled for December 11th, 2024. CHIP committee consists of 48 members from both the public and private sectors, including various Delaware County Health Department staff and community partners who are working with DCHD on Title V, the Department of Labor grant, and HRSA grant. So we have 3 goals of the Community Health Improvement Plan. One is to improve maternal, parental, and infant health outcomes through improved access to and awareness of community and medical services, decreasing opioid misuse during pregnancy, and preventing infant deaths. And then here's some of our data. This is our baseline data for 2017 to 2021. And our first objective, which is by December 31st, 2028, we have the goal of improving birth outcomes in Delaware County with a special focus on Black, Hispanic, and multi-race birthing peoples. So if you can see, we're going to try to get a lot of these measures down to about by 5%. So if you'll see all births, we are currently at 2.7%. We want to get that down to 2.6. For Black births, we are at 4.3% with a goal of getting down to 4.1%. For Hispanic births, we are at 4.9 with a goal of 4.7. And for multi-race births, we're at 4.7 with a goal of 4.3% by that December 31st, 2028. And then if you'll go down to the next, you'll see percent of babies born with very low birth weights. We want to try to reduce that all births down to 1.5% from 1.6. And for Black births, we want to try to reduce that from 3% to 2.9%. And then moving on to percent of preterm births before 37 weeks gestation. We want to see if we can reduce the 9.3% of all births down to 8.8%. The 12.8% for Black births down to 12.2. The 11.4% for multi-race births down to 10.8%. And the 9% of Hispanic births down to 8.6%. And finally, we want to get that percent of severe maternal morbidity per 10,000 delivery hospitalizations. We want to try to make that, it was at 100 or 103. We want to try to get that down to 97.9. And then for our second objective, again, by December 31st, 2028, we want to decrease the rate of neonatal absence syndrome among babies born to Delaware County parents. This is our baseline data for 2019. For our rate of neonatal absence syndrome per 1,000 newborn stays, we have 14.4. We want to get that down to 13.7. And then for our rate of maternal hospital stays with opioid use per 1,000 maternal stays, we have 23.2 with a goal of reducing that to 22. And then for our final objective to be achieved by that December 31st, we want to decrease the rate of infant mortality in Delaware County. Again, we have baseline data from 2017 through 2021. If you'll see on the left, we have our infant mortality rate per 1,000 live births. For all infants, we are at 6.3%. We want to try to reduce that to 6%. For Black infants, we have 12.7%. We want to try to see that lower to 12.1%. And for Hispanic infants, we have 7% and are with a goal of achieving a 6.7% by the December 2028. And then if you look to the right, we have percentage of total children under the age of 6 years old served by home visiting programs. For these ones, we want to increase the 0.23% for all children under 6 to 0.24%. And for children under 6 years at 200% of the federal poverty level, we want to increase that from 3.4% to 3.6%. Any questions? Yes.
I actually have a few questions. I really like the central intake pilot. And I noted the funding is 54,000. Is that sufficient to set up the centralized intake at this time?
So we are not planning on having it fully established by the end of that grant. We are developing the business requirements with partners, as well as selecting our systems partner. So we're going to need a software program and someone to manage that. So it's just going to be a pilot program, but it won't be probably launched officially in full by the end of this grant. It's just kind of setting the framework for that.
I do have a data question. I thought it was interesting that the Hispanic population had the highest no prenatal care. However, they did not see a significant, I think, prenatal issues or maternity mortality. If you look at that graph, I thought that was really interesting.
Yeah. Are we able to go back to that? You're looking at this one.
Yes.
Percentage of Delaware County births
Yes.
with no prenatal care.
Mhm.
For Hispanic. So we had the highest rate of no prenatal care, but we had the lowest rate of preterm births.
Mm-hmm.
Yeah, so I'm not sure why that's something that we are going to have to look into further, like why that is not, like why we're not seeing a higher preterm birth rate, which we would generally expect with no prenatal care. But that's something good. That is something good to point out, because maybe that is something that we're seeing in that population that we may be able to apply to other populations to help reduce their preterm birth rates. So thank you.
I think that's similar. to
Yeah.
what-
Oh, go ahead, Oni.
No, I was actually, thanks, Lily. I was thinking the exact same thing when I was looking at that graph. And just wondering, when you're collecting this, why, the same question, why that is, if they had no access to prenatal care. We're actually seeing similar issues in Philadelphia, where some women who are not going to get prenatal care are not they're not having any complications during birth or have low maternal infant mortality. So that would be really interesting to look into. So I'm sorry, I just wanted to echo that because I was thinking the same thing.
EJ had it.
Yeah, I have a few questions too. You said there are 2 clinical observation sites for the doulas. Where are they? Is that within the Temple system or?
So we have Mainline Health, and I believe I think they're both within Mainline Health at this time. I'd have to confirm.
Administered under Temple's part of the grant.
Yes, so Temple is the one developing the curriculum. It's going to be, during the first year, it's going to be their nursing students, I think exclusively. They have been working with Mainline Health Systems to develop memorandums of understanding and going through their bureaucracy and processes. So right now, I believe it's 2 different hospitals within Mainline Health system at this point.
And what is their capacity when they're fully trained? How many, moms are they going to be able to manage?
2 per student.
Yeah,
But
so
after they're fully trained and they're out in practice.
Well, since these are, since it's an academic program, they may not, honestly, they may not do it again. I mean, it's not that they take that and then are professionally going into that later.
Oh,
It's to try to keep having a population of students that can serve families. As you get new students, they will then do it. It's not that those, after they graduate, they'll.
I see. So they're not being trained to become doulas.
Correct.
They're being trained in the care patterns of doulas. These are nursing students.
These are nursing
Oh,
students getting a
sorry.
certification on
I
top of
I
their
didn't
curriculum to
appreciate
be a
that.
birth
Okay,
companion.
Okay, good. And with the maternal and infant mortality data, do you have that by zip code or, or any other, geolocator that you can target, interventions for?
So, I mean, we know where the higher rates are. I don't have that data on me at this point. I mean, we do see the higher infant mortality rate in Chester, as Dr. Higgins had said earlier. And there are programs that are working to address those regional disparities, particularly with Foundation for Delaware County and their community action network that they are currently implementing. They have developed similar goals to the CHIP committee, although specifically developed for the city of Chester in reducing that disparity there.
Couple more comments. Your neonatal obstinate syndrome slide,
Yes.
I would love to see that separated out with maternal opioid use as opposed to maternal treatment. So if a mom is on treatment for methadone or Subutex, the baby could still have neonatal obstinate syndrome. So, which is okay because the mom's in treatment and supposedly the day stay for NAS is a little bit shorter for methadone or Subutex, but you are not going to see a decrease at NAS, even though the mom is being treated. So just a comment on that.
To delineate that out for mothers who are still actively using versus in treatment. Okay.
And then I just want to also make a comment about doula reimbursement. I think you're going to need to train a lot more doulas. For 2025, Medicaid will be covering doulas. So doula, it's in our state contract. So I'm not sure the number of visits yet and the in-person delivery, but that's going to be covered under the Medicaid plans.
Yes, and that's actually built into the Department of Labor grant that we have with the Foundation for Delaware County. They are going to be doing the Medicaid billing for the doulas as part of that program and actually teaching the doulas in that program how to be independent after the completion of it so that they can start billing Medicaid directly themselves.
It'd be interesting to see the acceptance of doulas in hospital settings where they're in the delivery and, it's a big change for hospital systems. It'd be really interesting to see, what the requirements are to be in the hospital during deliveries, and their involvement during the deliveries. I mean, they're non-clinical, but, I'm just curious, have you seen anything about, any concerns at this time?
So it's funny you actually bring that up because in our CHIP meeting, our previous one, or 2 meetings ago, Dr. Goburn, who is the head of the OBGYN department at Mainline Health Systems, specifically said that he wants to develop Mainline Health into doula-friendly, a doula-friendly organization. So we have broken out in our CHIP group to kind of discuss that further. Through those discussions, Teresa Pettaway was able to give us some information about there's really going to need to be memorandums of understanding or policies that the health systems are going to be putting in place. Because we have independent doulas, we have doulas coming from different organizations, and there's lots of different trainings and expectations depending on where you're coming from as a doula. So really trying to develop policies at the hospital system level will make it a more welcoming and it'll allow the doulas to enter that system with the expectations of that specific healthcare system instead of what they're coming in with. And that will affect things like oversight of both hospital staff and doulas and centering the experience of the birthing individual with their interactions with both hospital and doula staff.
Yeah, and that's part of the Temple training as well, is to encourage the nursing staff to become more familiar with
The
it,
idea of being
with
a
the-
birthing companion and, exactly.
And incorporating them into the birthing cycle and the whole thing. Thank you. Great questions. Anne-Marie, because we can't see you. Does Anne-Marie and Oni have any questions?
No, this is great though. Thanks, and keep us posted on how it goes.
I'm good, thank you.
I was just thinking, because we briefly talked about this, but maybe in 2025, it'd be great to bring back the Maternal Child Health Committee to give them, an overview of what all the work that everybody did and where it's at. I think that would be a great meeting, and to also talk about some other initiatives that we could be working on with you.
Great, thank you so much.
Thank you.
Thanks, Steph.
Yeah, thank you. Okay, at this point, if there's no other questions from the board, we'll move to public comment. If anybody has public comment, now is the time, and just come up to the podium and just give your name and.
Hello, everyone. My name is Ahmed Khalifa, and I'm originally from the country of Sudan in East Africa. But I've been living in the US for the last 24 years. And recently, I obtained a master's in public health in epidemiology with a minor in global health. So maternal and child health is definitely one of my interests, and I did 3 courses on that. So, and my wife happened to be women's health nurse practitioner. So that's our the dinner table discussion, you know, the pregnancies and all that. I'm very happy that I came to this meeting and met the new director. Congratulations. And I hope that the efforts to advance health in Delco are apace. I live in Upper Darby, so I've been in Delco for a long time. So I just wanted to say I'm very happy that I've been to this meeting, and hopefully I'll be here for other meetings as well. One quick note I would note about the question, why is the Hispanic juvenile death rate is less while there's less maternal health care? Most likely, I think it will be the lifestyle factors, because the rates of smoking in Hispanic women is among the lowest in the racial subgroups. I think it's the second lowest compared to Asian women. And that's a major factor that can lead to premature childbirth. So I just wanted to put that in there. Again, thank you very much, everyone, for their efforts. And I'm looking forward to seeing everyone again. Thank you.
You should talk to Robert about joining the maternal child health group. So, okay, so any other public comment? With none of that, we just want to recognize that we will be announcing the 2025 schedule. We do not have that finalized yet. So we'll make that publicly available. Most likely we will have a meeting in January, so we're just confirming that with the county and that and the board with everybody's schedules. So the next meeting will be in January.
Okay.
And I wish everybody a happy Thanksgiving. And again, congratulations to our new director, and thank you all for coming tonight.
Yeah.
The meeting's adjourned.
Thank you. Happy Thanksgiving.
Happy
Happy
Thanksgiving.
Thanksgiving on you, Emery.